Globewatch with me, Michel, aired from the Hilton Hotel here in Yaoundé. 1.3 billion people emanating from 54 countries. We are talking about Africa, which is a summary of the United States, Europe, and Chinese territorial spaces combined. And why not time for the continent to create its own medical agency? It is one of the priorities of the African Union ever since it was founded in 2000, replacing the defunct Organization of African Unity. What will be the focus of the African Medicines Agency in the 21st century, dominated by pandemics such as the one we are living today, COVID-19? My guest today on Globewatch is the former UN Under-Secretary General, former Executive Secretary of UNAIDS, and former Malian Health Minister, serving today as AU Special Envoy for the African Medicines Agency. Michel Sidibe, thank you very much indeed for being guest on Globewatch.
Thank you very much. It is an honor and privilege for me to be with you today.
First of all, how do you define the African Medicines Agency?
Let me just start to say that you have been mentioning data which are very important before defining what is the African Medicine Agency. When you talk about 1.3 billion people in Africa, it's very important. But you have to make sure also people can understand that out of those 1.3 billion people, we are representing 25% of the morbidity of the world, which is so important. If we are presenting 25% of the morbidity of the world, and at the same time we are producing only 3% of the medicine that we are consuming today, and we are not having even 6% of the expenditure, health expenditure in the world, something is wrong. What we need to do about it, that's why we have been thinking about African Union. The political leaders started thinking about putting in place a mechanism which will help Africa to reposition themselves, to have a common voice, to make sure that we can reduce our dependency vis-a-vis the developed world. And today, this agency will help, certainly, if established. Like I said, we need to have 15 countries who will ratify this treaty before the treaty could go into force. So that is something very important to mention. It's about not just creating a new bureaucratic structure. It's about reducing dependency. It's about getting our sovereignty in terms of producing medicine and vaccine.
Of course, you just gave data there which has to deal with the continent, and one of the key issues and challenges facing the continent today is how to tackle the multiple health challenges the continent is facing. What will be the added value in terms of bringing Africa together as Visions 2063 outlines, with the creation of the African Medicines Agency, which you intend to model from the European Medicines Agency perspective?
I think very important. First, we need to have African health diplomacy, which is very important. Like I said, Africa can really make a difference. Today, we need, without any doubt, to Africanize research and development. If you look at what is happening generally, we are taken hostage by research and development of the North. To give you one example, we discovered malaria 142 years ago in Africa, in Algeria, but we're still struggling to have a vaccine. We're still struggling to have medicine which will really help us to cure malaria. But the problem is that Africa need to have their own research priorities. So if we don't have that one, we cannot expect that others will have that for us. Look at what is happening with COVID. COVID is coming. We are all taken hostage by this situation, which is not just about public health issues. You are talking about public health. We realize that is economic issues. It is security, human security issues today. And this virus is just showing that if we are not careful, it will become endemic. But what is happening? We are seeing a huge divide.
Endemic means that we will start living with it, like we are living with HIV and AIDS 30 years ago,
exactly.
or other diseases,
so
malaria,
because if
tuberculosis.
Of course, because if you look at what is happening today, we are experiencing a profound divide in the world today between the North and the South. We are today, I can say, 1.2 billion people in Africa were waiting, they are still waiting for having a vaccine, of COVID vaccine. The world vaccine which has been administered to all in the world today, Africa received only 1.2% of those vaccine. So if we don't start thinking about manufacturing our own vaccine, 99% of the vaccine are coming from abroad. It's impossible for us to really break up the backbone of this epidemic. So it's a key issues today.
This is a project which is so key to the African Union, which itself inherited the structure of the Organization of African Unity, the organization, and by 2009 the African Union governments decided that we need this kind of a structure to help solve the problems of the continent, and by 2019 the African Union ratification process started.
Yes.
That okay, the African Medicines Agency can go operational when just 15 countries must have ratified. What I want to get from you is that what will be the key areas of intervention of the African Medicines Agency? Is it African traditional medicine to standardize it? Is it handling vaccination issues? Is it research or other general health issues?
I think it's a very important question what you're asking, but we have to just make sure that people don't confuse what could be the African Medicine Agency and CDC.
I'll come to the question of CDC in a moment.
Okay, so let us come back to African Medicine Agency. I think first is to help us to really improve what I can call a standard setting regulation. Today, the harmonization is almost inexistent. We are having a fragmented approach. Whatever you can get as a new molecule could take even 5 years to come into Africa because we have 55 countries. We need to help to better harmonize, but we need also to build on those regulatory systems to make sure that they can be helping a continent to better monitor the quality of medicine which are coming in our continent. You know that some countries are having almost 40% of their medicine which are fake or substandard, counterfeit medicine. So we need to establish a mechanism. So African Medicine Agency will do that.
Mr. Sidibe, the tax of manufacturing, for instance, is it a priority that the African Medicines Agency will be handling? Because as we speak, of the roughly 375 manufacturers on the continent, just 3 of them are indigenous. Is that going to be a key mission?
Of course, that is a critical mission, because like I was saying, the regulatory system need to be put in place which will help us to really improve what we are having today as a capacity. But more than that one, also I was saying that we need to Africanize our research and development. You are talking about traditional medicine and others. You know that most of medicine which are produced today, they are produced based on what we call the ingredients, so active ingredient, pharmaceutical but those are, most of them are coming from traditional medicine. So we will be helping to also create enabling environment for making sure that local production of vaccine. And this African Medicine Agency will also tap on existing agreement, like the free trade agreement, which will help to make sure that a drug can move from one place and
which has opened the market, the market. African economy.
So, and that can really help us, because don't forget that today we are talking about almost, I can talk about the market because you're talking about
Absolutely.
The market. You know, the medicine market is $1,400 billion, but out of that, Africa has only 1.2 billion. So if we create,
almost
we can
0.7.
So we can really create job, we can transform the environment, we can produce our own medicine, but we can have a hub of excellencies. Like, for example, CDC Africa working with leaders like President Cyril Ramaphosa, who is a champion for COVID. They're trying to make sure that today we can already have the capacity.
Is it time with the African Medicines Agency to standardize what is normally called African herbal medicines, which in most cases are not approved by the World Health Organization, quote unquote, the world's medical doctor?
I think that is all those opportunity will be there. What we need first is to make sure that we upgrade our capacity. For example, most of our countries today are maturity to levels, which means that even if they're producing any type of medicine or vaccine, to sell it outside will be difficult. So you need to reach some level of maturity in terms of is a benchmarking which have been set by WHO. But this African medicine can upgrade countries to make countries reaching that, and then we can use all those elements you're talking about to be able also to negotiate with a different part of the world. It's not WHO only that, but it is also other part of the world who will have to sit with this African Medicine Agency and discuss and see how they can move the things differently.
In a moment, I will talk about the difference between the African Medicines Agency and the African Center for Disease Control and Prevention. But first, you are on a continental campaign to lobby African governments, political leaders, parliaments, to understand the value of ratifying the African Medicines Agency. What message are you delivering to the various governments? I
think it's very important. We have to, the message is very simple. We are in 2021. We cannot continue to say after 2 years of I said of COVID, which is affecting most of our countries. We are seeing a third of waves coming, that we have only 8 million people out of 1.3 billion who receive 2 doses of vaccine. So if we don't have our own regulatory system, if we don't create enabling environment for producing quickly this vaccine, for attracting, for fighting against those fake medicine I was talking about, and those fake medicine, as you know, is a criminal twofold. First, it is mafious people who are taking advantage of that one, of the poor people, but also our poor people. You are talking
about illegally sold drugs, medications,
exactly,
on the continent.
On the continent.
In the black market.
In the black market.
In most cases, do not meet the health standards.
You know, in your countries already.
How much of a danger do they constitute to the health of the people? I mean, fake medication.
I said it's criminal because first you're giving a space for criminal people to take advantage of poor people, but it's criminal because also you're killing poor people who are obliged to go to this market and take substandards or even fake medicine, which we need to really change completely the space of that, because for that only reason you will lose a lot of revenue for your country, If you take, for example, Cameroon, is 400 millions of CFA just for fake medicine. So this is a huge loss for the continent, and is not helping to create a space for establishing a proper local manufacturers which will want to really produce medicine.
Oh, well, African governments equally established the African Centers for Disease Control.
Yes.
The current director, John Kengason, is a Cameroonian,
yes.
happens to sit on the same place you are seated. Last year, he was guest on this program. What would be the difference between the African Medicines Agency and the African Centers for Disease Control and Prevention, all headquartered at the African Union main office in Addis Ababa?
Yes, I think those are sister agencies, and by the way, John is doing excellent job. He's a young brother, and CDC is primarily about strategic information, training our countries to make sure that we can anticipate and we can be better organized and equipped for preventing emerging epidemics.
CDC will be a medical think tank.
Yes, is a
continent.
Yes, exactly.
And the African regulatory
more than a think tank.
Agency will be more of a regulatory that sets standards.
What
can be consumed and what cannot be consumed.
You understood.
So like something that gives a final approval.
Yes, it's a little bit.
What is consumable?
Yeah, exactly. It's like a CDC in US and FDA. So it's the same. One is more on the regulatory side and also standard setting, and also creating an environment for making sure that we attract the best product for our continent, and we create enabling environment for producing medicine and vaccine, tapping on this free trade agreement. So, and trying to just make sure that we produce, we create also in the continent hub of excellences, which will really be attracting the best young people for research and development. So those are critical. CDC is very important, and CDC is filling a lot of space of today because AMA is not existing. African Medicine Agency is not existing.
You are visiting governments to facilitate the process. As of today, how many countries have ratified?
I think
to reach the 15.
I think we are really not far from getting our 15 countries. I can say that in the pipeline today, we have almost 12 to 13 countries who are in process of ratification, or almost finished with ratification, in process of deposing their instrument of ratification. So African Union. So we have today 12 who ratified, and 2 probably will deposit their tool instruments of ratification in African Union very quickly. And I can say, for example, your own country, Cameroon, with the leadership of the President of the Republic and the Parliament and all those actors who have been supporting that, are just ratified. So it's very important. Now we are waiting for the instrument to be deposited, but that is a process which will come. But I'm saying,
I introduced you at the start of the interview as the former UN Under Secretary General, as the former executive director of UNAIDS and former Malian health minister. You have occupied all these strategic positions, especially in the health domain. When you look at the problems of health facing the continent today, you yourself coming from one of the most rural communities in Mali, what do you think are the key health challenges on the continent today? HIV and AIDS is still a real headache?
No, I will say, I will both of the issues in a different perspective, not going on disease, one disease again, another disease. Yes, or another pathology. I think the issues is governance, health governance. We need really to rethink completely our governance system to make sure that health of the people is not anymore considered as just an expenditure, a cost, but it's considered as an investment which needed to be done if we want to transform and to not be taken hostage by the situation we are having. Two, we need to really reinforce the interface with community, reforming completely our primary health care so we be able health infrastructure, but at a peripheral level by training community health worker and digitalizing health. If we don't go through those processes, we will certainly continue to have costs which will be so high to take care of people and not the capacity really to provide a proper services. So that will be also with a clear understanding of our continental review of what we can be able to do to reduce this gap, like I said again, in terms of accessing basic medicine, accessing vaccine, making sure that we better regulate our areas of work.
You and I are living in the era of COVID-19, plus 170 million people are infected globally today, plus 4 million people have died ever since the pandemic started in the Chinese city of Wuhan on December 30, 2019. The least vaccinated portion of the world as one of the therapies administered to control and contain the spread of the virus has been vaccination through a plethora of vaccines which are available: Pfizer, Sinopharm, AstraZeneca, Moderna.
You can continue.
You can continue. What have you diagnosed as the main problem facing vaccination in Africa?
The problem is very clear. If you don't have vaccine, how you will vaccinate people? I just told you 1.2 billion people didn't have one single dose of vaccine. It's not because the mechanism which has been put in place are not working. Is because also we are faced with vaccine nationalism, which means that people are keeping the vaccine for the developed world today. So unless we reinvent the notion of solidarity, unless we have a more shared responsibility with a true global solidarity, I don't think we will be. Because the problem is that we will be faced with production issues, like I said, in 2021, 2022, 2023, we will have a production issue, particularly the world producers, which is India, were faced with a major challenge. So they move from a net exporter to a net consumer, even importer. So that is the issues we need to deal with, because 75 to 70% of the vaccine which were supposed to come through COVAX mechanism for supporting developing countries, particularly Africa, were produced by Serum Institute of India. So now they're producing for themselves. So we need to understand that the biggest challenge today is one, to really move quickly and start producing, taking advantage of this opportunity to create our hub of excellences, and make sure that also we continue to really better understand.
Mr. Sidibe, yes. Let me ask you this question. What do you think vaccination or vaccinating people is important?
You have two issues here. One issue is vaccine is important, or second issue is the hesitancy which are being created for different conspiracies, different messages which were not necessarily. The first things we are trying to deal with today is to make sure that vaccines are available, and vaccinating people is the only way. If you don't have at least 60%, like John was saying, or I will say 80% of the people vaccinated, you will not break the backbone of this pandemic. And if you don't break it, what will happen? You will have different variants which will come. Mutation will go on. And look at what is happening already in Uganda. They have today 5 different variants. They have Indian one, they have Brazil one, they have South African one, and they have their own variant they discover, and they have a UK. So that creates a major challenge for us, because if you don't reach quickly a level of this immunization of 60% or immunity amongst communities quickly, we will continue to have those type of new variant which will come, and like I said, it will become endemic. It will, and don't forget, if you don't really immunize the world, you cannot immunize one part of the world and think that you're safe.
The former UN Under-Secretary General Executive Director of UNAIDS, former Malian Health Minister, today African Union Envoy for the African Medicines Agency, Malian-born Michel Sidibe. Thank you very much indeed for being guest on Globewatch.
Thank you very much for an excellent interview.